What's up, YouTube friends? It is my last week in Phoenix, my last week of work. A couple days from now, I'm gonna get on the Arizona Trail for a week and go backpacking. And with the events happening right now with coronavirus, it seems like the best thing to do is get out in the wilderness away from the crowds. So I wanted to ask you if you're worried about the coronavirus, because I'm not worried about the coronavirus, and I'll tell you why. I'm a nurse. I have been working in hospitals for 35 years, and every day I walk into an infection, a virus, a bacteria, whatever. I walk into that every single day, and I want to encourage you that this is gonna pass. We're taking all the precautions. It's bringing awareness to the public that hand washing is the #1 way to prevent infection. Also, the CDC recommends that if you think you've been exposed to coronavirus, don't panic. Call your doctor, tell them what your symptoms are, because the symptoms of coronavirus are high fever, coughing, and shortness of breath. Right now, the CDC says that 80% of people that have been exposed or contracted the virus have very mild symptoms, and it goes away within a week or two. That's why they recommend that you stay home while you're symptomatic. There's 20% of the population, which seems really, really large, who might develop worse symptoms. So by calling your doctor, they can tell you, hey, yeah, we do want to see you, we want to test you and make sure you're okay. Most of those people already have some kind of underlying medical health problem, like some kind of lung issue, or they're immunosuppressed from something else. The best thing you can do is just stay home until your symptoms are gone. I thought it was kind of funny that they were canceling all the big events that are happening nationwide until I learned that back in 1917, when we had the biggest recorded pandemic of the flu, St. Louis, Missouri and Philadelphia, Pennsylvania decided that maybe they should cancel their big events. Philadelphia canceled their big events right away, but St. Louis decided to hold off to see what would happen. And in St. Louis, they had a huge number of flu cases compared to Philadelphia that did not get hit as hard. But Philadelphia discouraged gathering crowds in large places. So there's really good data available. There's really good evidence to support all the things that the government is proposing. That's fine with me, because I'm an introvert and I don't like crowds on any given day, whether there's sickness or there isn't sickness. You won't find me at a concert. I have trouble going to church because I think church is too crowded. As a nurse, I wanted to say something positive. So if you're worried about the coronavirus, do yourself a favor and turn the television off, because in typical news media fashion, they are honed in super closely on the bad news, the statistics of who is getting the virus and who's dying from the virus, and it's like looking at your map and zooming in to a pinpoint But if you zoom out and you look at the big picture of what's happening, the number of cases and the number of deaths from coronavirus it doesn't even register really, percentage-wise. Focus on the things you can do to keep yourself illness-free. Remember to wash your hands and stay home if you're not feeling well. And don't go into crowded places. Be encouraged. We're gonna get through this, just like we get through everything else. Right, okay. I'll see you out on the trail.